Hello, today I'm going to be teaching a patient on how to self-administer Lovenox. So today the patient is being discharged after a recent diagnosis of atrial fibrillation. The patient is 30 years old. He lives with his family at home and he is oriented to person, place, time, and situation. He prefers to learn through hands-on demonstrations and through pictures to help him imagine it better. And he's never had to self-administer any injectable before, so this is a new concept to him. By the end of this teaching lesson, the goal is for the patient to know how to self-administer Lovenox and to name 3 safety precautions to prevent excessive bleeding, as well as stating the purpose to inject Lovenox. So first I want to start off by explaining what atrial fibrillation is. So atrial fibrillation is a common type of heart dysrhythmia, and essentially what happens is these 2 top chambers of your heart, as you can see here, are beating irregularly and too fast, which is causing your heart to beat super fast, and that blood isn't able to pump through your heart effectively, so it just sits at the bottom of these 2 chambers that you can see here. And when it pools there, when blood just sits there, it causes it to clot, which is very dangerous because that could cause a stroke, that could cause a heart attack, that could cause other things. So here, this image kind of helps you imagine what's going on in your heart right now. So this is a normal heartbeat. As you can see, when it goes back to this, it's beating, synchronized at the same time. Those valves are opening when they should be. And this is what's happening in your heart. You see how these 2 chambers are beating fast, and then the valves are kind of just going all over the place. They're not at the same time that your heart is beating. So then all this blood just sits there. And then this is what your heartbeat looks like on a monitor, and this is what a normal heartbeat should look like. So it's just kind of funky there. And this is the image that is being shown. Do you understand that information, or does this make sense to you, what I'm saying?
No, it makes sense.
Yeah, okay. Do you have any questions about this?
No.
No, okay. So like I mentioned, when you have AFib, atrial fibrillation, it causes you to be at a high risk for blood clots. So with what you're prescribed, it's called Lovenox, and Lovenox prevents those blood clots. And what happens essentially is it blocks the actual clotting factor that your body uses to help you clot blood.
Okay.
So it just prevents you from clotting.
Okay.
Because your blood is also thinned out, so it's super liquidy.
Okay.
Does that make sense?
Yeah.
I know it's kind of clot this, but do you get what I'm saying? Okay.
It just stops it from clotting.
Yeah.
It interferes whatever.
Yeah, the clotting factor, which is called factor XA, but I mean, that's irrelevant. So you will be taking warfarin and Lovenox at the same time, and simply the doctor orders both warfarin and Lovenox because warfarin is an oral medication which takes longer to build up in your system to adequately prevent blood clots, while Lovenox works much faster within days. So then we just want to make sure that you're building enough warfarin before we take you off the Lovenox and just do warfarin.
Okay.
And so at one point you'll stop taking the Lovenox and you'll continue taking the warfarin.
Okay.
So now I will show you the parts of the actual syringe. So this will come in a pre-packaged little box, and this will be off, it'll look like this. The medication will be here, and the little syringe part, and then this is called the plunger, which is the part that you're actually going to push down on to inject the medication. And then this part that's capped is the needle.
Okay.
And you want to be very careful when uncapping it to not, inject yourself or to stab yourself in other places. And Lovenox is taken every 12 hours at the same time every day. Every day. So if you take it at 8 a.m., you want to take it at 8 p.m. If you take it at 9 a.m., you take it at 9 p.m. Every 12 hours at the same time.
Okay.
Because if you don't, It can either cause you to not have enough Lovenox in your system, or vice versa, you have too much in your system by the time it's your second dose.
Okay.
Does that make sense?
Yeah.
So if you're taking it at 10 p.m. or 10 a.m. and then you take it at 8 p.m., that's too soon.
Yeah. Okay.
So you want to make sure that you're evenly distributing it. Okay. And now we'll discuss the actual self-administration part.
Okay.
Let me know if you have any questions or if you want me to pause to repeat anything. Okay?
Okay.
So first what you want to do is you want to wash your hands, whether that be with hand sanitizer or that be with soap and water. And that could be, that could be either way. You just want to make sure that you're washing your hands for at least 15 to 20 seconds, okay?
Okay.
And then you'll grab an alcohol pad and you're going to clean the site that you're going to inject yourself into. And it's going to be right here in your abdomen, but you want to make sure that it's at least 2 inches away from your belly button, okay? So then once you clean that off, you're going to open your package, your syringe package, making sure not to use the actual needle or the syringe part to open the package, because that could damage the needle or the syringe itself. So once you have it open, it's going to look like this. And then you're going to uncap it, being careful. I'm not going to actually uncap it just to protect ourselves from the needle. You're going to uncap it and then cap it just for safety purposes. And then you're going to hold it between your middle finger and your thumb. And you're going to, you don't have to place your finger on there, but you could just keep it like close. And then you're going to grab a little bit of fat. And then if you want to do it like somewhere closer to the side, sometimes that helps with the pain a little better. So you're going to hold it. You're going to aim it at a 90-degree angle. You're going to poke yourself, and then you're going to slowly administer it, making sure all the medication goes in. And then you're going to take it out. You're going to let go. You're going to press firmly down to release the safety mechanism. And then you're going to put that in the sharps container, okay?
Okay.
You're going to leave the area alone. You're not going to massage it. You're not going to rub it. You're not going to do anything because that can cause bruising. So you just want to leave it alone.
Okay.
Do you have any questions?
No, I think it's pretty straightforward.
Okay.
So.
Are you able to demonstrate that back to me?
Yeah. So I got to start by washing my hands, either with soap and water or hand sanitizer, whatever works. Get the prepackaged needle medication stuff. Take it out of its package, and then with an alcohol wipe, gonna wipe the area down where I'm gonna inject. Make sure it's clean. You said typically these will come like this, right? Like
yeah, the medication will already be drawn
so
up and everything. So it'll just be like that. Yep.
Okay. It out of its package. It's gonna have to take the needle cap off. Be holding it like this.
Between your fingers.
And then once in the area that I'm gonna inject, pull it up and inject. And then press down firmly until we're done. Continue pressing down once it's all gone and out of me.
Yeah.
To engage the mechanism, the safety mechanism. And then throw it into a sharps container.
Yep. And then, sorry.
And then leave it alone. Don't mess with the area because it can cause bruising, right? Or something?
Yep, it'll cause bruising. Yep.
Okay.
Did you say what angle you would hold it at?
No, it's got to be straight in, right? Like
at a 90-degree
90
angle.
degree. So.
Yep, exactly. Perfect. All right, do you have any questions? Does that make sense?
Yeah, I mean, it's pretty straightforward, I guess.
Okay, perfect. So now that we know how to self-administer the Lovenox, I want to talk about bleeding precautions, because now your blood is going to be thinned out, and you're gonna be more susceptible to like excessive bleeding or bleeding for long periods of time, because your blood is just able to come out easier than somebody who's not on a blood thinner. So the first thing we recommend is to wear a medical alert bracelet. And simply, that's just for medical emergencies, in case you were to become unconscious during I don't know, car accident, or you fall and you hit your head on something and you become unconscious, and now you can't tell people I'm on a blood thinner. And the reason we want to let people know you're on a blood thinner is because a fall or a traumatic event can cause you to bleed internally, and we want to get you help as soon as possible. So it's important to let other people know so that they can tell, like, EMS, like, hey, this person's on a blood thinner, we need help, like, right now.
Okay.
Once again, it's just for medical emergencies. And then we also recommend the use of electric razors, and because your electric razors are less likely to cut you than a normal, like, straight razor would, and a little cut on your face can bleed for a long time. Same thing with, like, little paper cuts or something that you would normally not bleed for a long period of time, you will because you're on a blood thinner. And then lastly, I would recommend to use a gentle or a soft bristle toothbrush and use it gently. So don't, like,
Okay.
brush too hard on those teeth. And that's simply just to prevent gum bleeding, because your gums are just super sensitive. But I will say that if you are using a soft bristle toothbrush and you're brushing your teeth gently and you're still bleeding profusely, I would call your provider and let them know that. Same thing if, like, somebody just, like, bonks you on the arm or just, like, taps you like this and then you get a giant bruise on your arm the next day. That's something that you should definitely call your provider for, because that probably means that you have too much blood thinner in your body and it's causing excessive bleeding.
Okay.
Do you have any questions about those? Or do those make sense to you?
Yeah. No, it makes
Yeah.
sense. Like,
Okay.
I got it.
Okay, perfect. Are you able to repeat back those precautions to me?
Big part of it is I will bleed a lot and bleed easily from
Yes.
small cuts and things like that. So avoid regular razors, stick to electric razors, or brushing my teeth too hard. Preferably using some soft bristle toothbrush. And then to get a medical alert bracelet, kind of letting everyone know, hey, I'm taking this blood thinner because if I'm unconscious or something due to like a wreck or something, whatever the case may be, they need to get me help fast because I'm gonna bleed out probably.
Yeah. You could bleed out without them knowing that you're bleeding out. So yes. So yeah, do you have any questions? No? Okay.
No, makes sense. I'll eventually get off of it, right? You said I won't.
Yep.
Okay.
Yep. You'll be taking just the warfarin, which is another blood thinner, but like I said, it just builds up slower in your body, so it takes your body a little bit to effectively thin your blood.
Okay.
So that's the only reason why you'd be on both for now, for the time being.
Okay. Yeah. No, that's fine.
Okay. The goal was met as evidenced by the patient demonstrating that they know how to self-inject, and they stated what precautions to take to prevent excessive bleeding by the end of the lesson. Thank you.